Hello, my name is Dr. Carolyn Newberry, and I will be your host today during the ASPEN Physician Spotlight. I'm excited to be speaking with Dr. Molly McMahon, who is a professor of medicine within the Division of Endocrinology at the Mayo Clinic in Rochester, Minnesota. Dr. McMahon, thank you for joining us today.
Carolyn, thanks. It's always fun to talk to another nutrition physician.
Absolutely. And I was hoping, you're such an established voice, in the Aspen community as a former president. And I was hoping you could just go back to the beginning and tell us a little bit about how you got involved in nutrition.
Sure. So I was fortunate to grow up in a family that really stressed nutrition and activity. And then when I became an endocrine fellow at Mayo, each fellow was asked to do a rotation in ambulatory nutrition and in hospital nutrition, which is kind of unusual for endocrine fellowships. Right before that, I had spent 18 months doing research in carbohydrate metabolism. And then I started this hospital nutrition rotation, and I was just hooked from day one. I just loved it. I loved the cases, and it felt like applied metabolism research to me. I loved the breadth of the cases, the physiology, and I loved the fact that one minute you could be in an ICU seeing someone for parenteral nutrition, and the next minute you could be in an ethical discussion with a patient on a ward about a peg tube decision. So I just had an immediate passion for that practice. And then as I went through my career here, I've been fortunate to have a lot of different opportunities. In some ways, I think now is the time for nutrition because we're not only in an obesity epidemic, but we're in a malnutrition epidemic. There's such a breadth, and each specialty brings something different. And that's probably the beauty of Aspen and of hospital nutrition. I, as an endocrinologist, have particular expertise in metabolism and conditions like diabetes and obesity, dyslipidemia, as you, as a gastroenterologist, have bring your own skill set. And so I was fortunate here also to be able to have roles in food service and healthier nutrition on the campus and in co-directing a Mayo nutrition course and also in developing healthy nutrition for our employees at our wellness center. So I think there's so many opportunities in nutrition. I've been fortunate to have kind of a variety of them, but my passion is hospital nutrition.
Yeah, I mean, and it's great to hear, you've been involved in such a depth and breadth of nutrition services. I know that you are the director currently, right, of the nutrition program there at Mayo?
And particularly now, yes, of the hospital nutrition services and of the dietitians. So yeah, thanks.
That's great. And I don't know if you want to tell us a little bit about that program and sort of how you've built it over time, because I know you've now been there for a little while.
Sure. No, I loved it. I was able to go, Mayo has a program where they will send a physician elsewhere for a year of special training. And I was allowed to go somewhere to get special training after my endocrinology fellowship, a year of a hospital nutrition fellowship, to be able to have the skills to help develop our nutrition team here. We're really fortunate to have the support of our institution. And I know it's somewhat of a unique team now, but that's okay. Every institution will have its model. Here, we still have every discipline. We have a physician leader, and then we have a resident or fellow, a nurse, dietitian, and pharmacist. And I know different models will exist differently. You mentioned in your interview how limited nutrition education is to physicians, and that's true everywhere. So we're lucky to have the residents, all residents with us all medicine residents with us for a week. Yes, it's a short time, but we can give them a little intro. And then we have fellows from endocrinology, GI, or critical care work with us. We've developed a teaching program using the web, and much of it is case-based nutrition. So we're looking at new models now because during COVID, we recognized how much we could do with remote work or telehealth. And so Dr. Manpreet Mundi and I are beginning to look at should we have an evolution of our model, because I think it's always good to look at evolving models. So in a nutshell, we have two hospitals here at Mayo Clinic, and each one has a separate nutrition support service team.
Yeah, I mean, that's so great to hear. I know I've heard so much about the Mayo model with working some of the other positions at Aspen, including Dr. Manpreet. So it's so nice to hear everybody collaborating together. And I really hear sort of a multidisciplinary approach to your nutrition service. And I don't know if
Yeah.
you could speak more about that and the importance of that, like in the team.
Sure. I think there's such a synergistic benefit of having every discipline so that the end result is more than additive. Everybody adds something different. And I think that's very similar at Aspen. You know, I think Aspen in some ways was ahead of its time in the multidisciplinary membership. Also look at all the disciplines or all the specialties of physicians that are in Aspen. So we're fortunate at Mayo to have a multidisciplinary team. And I'll mention one other thing. It's so helpful to have data drive things. Early on, I had such a supportive chair of medicine, and I told him I thought the use of parenteral nutrition was too short in duration. This is quite a long time ago. And he said, okay, I'll have someone help you get data, and we got data showing the duration of use of parenteral nutrition was too short. So we had a mandatory then consult for patients on medicine services that the nutrition team would have to see before starting parenteral nutrition. So we really have had quite a bit of support. And then another very cool thing is, I bet it's 15 years ago, a pharmacist and IT person and I developed a rules based program called FEED. You have to have a catchy title here, it doesn't go. So that stands for Feeding Effectively Using Electronic Data. And we developed a rules based system so that we could go to rounds in the morning. And on one sheet, you would have anthropometric information, exactly what was in the parenteral nutrition, including macro and micronutrients. And below it would say the percent of goal calories, the protein per kilo, the percent lipid. On the next sheet, you'd have the key labs that we wanted to look at. And the rules were that if someone, quote, violated a rule, they would have an asterisk before their name. So that if they were fed out of our guidelines or if a lab test was out of range, the name would be flagged. So not only did this help us standardize our care, but it helped us prioritize who should be seen earlier on rounds. The problem is our new electronic health vendor couldn't reproduce feed exactly. So we're trying to get back to what we had before because that was really helpful to us.
Yeah, absolutely. And it sounds like that's definitely a quality assurance perspective where you're actually following patients and making sure they're meeting specific goals.
It is. And making it more efficient, right? Because it can be so cumbersome to pull all the data required. And everybody on the team, the different disciplines could format it differently. So Dr. Mundi and I are trying to get back to figure out how we can get our old system in our vendor.
Right, absolutely. And, I wish there was some type of national model that we could use this type of software and technology at other institutions. For instance, I'd love to have this type of perspective, here at Cornell, where I'm practicing, where we could follow patients and have automatic pulls of data to sort of titrate their different nutrition regimens.
Yeah, and as we were talking, Dr. Mundi and I were just talking yesterday because he knew I was going to be visiting with you. Wouldn't it be great if we could look at data outcomes with our, combined electronic health medical records?
Completely agree. I think that's a nice segue too. I've been asking all my interviewees sort of what they think is the future of nutrition and where we need to go. And I don't know if you feel, I often feel like technology is one tool we're definitely going to be using in the future. And if you have any other thoughts on that.
No, I do too. I think, again, our experience with COVID showed us we can have our model evolve. So I think telehealth will be key. We're trying to figure out here, we have a large health system. Could we begin to help these healthcare systems electronically? Because as we mentioned, people don't get enough training in nutrition. Fortunately, you did, and some of us did, but we need to share that knowledge just like you're trying to do with the programs you described. So one thing is telehealth or evolving our model. Secondly is trying to find different ways to educate all our staff on nutrition, and that's a challenge. We have a very large institution, so we're looking at new models of trying to give basic information to people. Surveys continue to show, unfortunately, that despite these epidemics of obesity and malnutrition, physicians and other disciplines are just undertrained. So I think our immediate focus here will be trying to use telehealth and then also seeing if we can use big data to look at outcomes with some of our patients and parameters.
Yeah, I completely agree. And I look forward to hearing what Mayo has to offer so that we can all tap into it in the future. One of the things
And we'll be looking to see what Cornell offers to us. You're right. It's so bi-directional, isn't
it
it?
is, it
Yeah,
is.
that's the fun of working together.
Yeah. And I know, one of the things that we're doing within the physician engagement committee is trying to come up with some guidelines for actually building nutrition programs like in centers that maybe don't have them or don't have them as well established. And, one of the things we're finding is that the environments are so different, between Manhattan versus Rochester, Minnesota, and
Yes.
how the care looks. And so I don't know if you have any thoughts about how we can build systems that are universal that can be used in these different areas and sort of how we have to manipulate them.
Maybe today is a first step. I mean, you and we and other groups getting together to talk. We've tried to do this over years. I know Dr. Mechanic and we and others talked quite a long time ago. Part of the challenge is our time of residents and fellows. We tried to carve out more time, and they keep telling us other rotations need more time. And I think we're not unique here. Much of the residents' time is going more to ambulatory rotations away from the hospital. So we're also challenged, but I think it's discussions like this, and we come up with ideas collaboratively and just pilot them.
Absolutely. And I look forward to speaking off camera then about some of those collaborative
Yeah,
opportunities.
it sounds great.
And I think that we are near the end of our interview. So I was hoping you could just tell me a little bit about how Aspen has shaped your career. Again, you've been so influential within the organization, and just to leave our members with a little bit of information about how they can use Aspen in their careers.
Sure. Well, my two main mentors were prior Aspen presidents, Dr. Fleming and Dr. Bistrian, and how lucky was I with that? So that kind of introduced me to Aspen. I think how Aspen has helped me is it's very welcoming, but again, it's team science and it's team care. And I think that's the future of medicine. Every discipline has a role. And so I think that's been the main benefit of Aspen to me. It's also meeting people like you and other physicians involved in nutrition.
Right.
So, in a nutshell, I think it's the team approach and the team science approach. And there are plenty of opportunities for people to get involved. So, I just encourage people to start in any way. And as you develop your experience, you'll be tapped for other experiences.
Right. Absolutely. Well, thank you so much for sitting and joining with us. This is another edition of Physician Spotlight, and we look forward to seeing you next month. Thank you.
Thanks again.